literature, and racial aspects of World War I. His outdoor talks, which combined class and race issues, inspired Marcus Garvey and would later inspire Malcolm X, A. Philip Randolph, and Dr. Martin Luther King Jr. to follow his methods of communication. Harrison died at the age of 44 on December 1927, and is remembered as the most distinguished, if not the most well-known Caribbean radical in the United States in the early 20th century. For more information on Hubert Harrison, visit harlemworldblog.wordpress.com and jeffreybperry.net. Perry is the author of Hubert Harrison, The Voice of Harlem Radicalism. Hubert Henry Harrison is a true Harlem legend.
There's hundreds of fun and simple things you and your family can do to live a healthier lifestyle. Here's 20 of them. Walk to work, walk the dog, have the dog walk you, take a hike, take a bike, skate, dance, hop, jump, do the Humpty Hump, skip seconds, skip dessert, skip to my loo, don't skip breakfast, drink H2O, lower your sodium, raise the roof, shake your booty, stock up on vegetables, and don't forget to eat them. Search We Can online to find more ways you and your family can get healthy together. A message from the Ad Council, HHS, and NIH's We Can program.
WHCR 90.3 FM, New York.
And colors, poison them against their sisters and brothers, yes. That is not the way that it's supposed to be. We were meant to live in peace and harmony. There are so many old moons and skies keeping us apart. It's time for healing inside of you and me.
Good evening, ladies and gentlemen of the listening audience. I'm Maurice Selby, or I'm gonna start saying it as Sean said. Dr. Maurice Selby.
And I am Sean Shivers in that deep voice like you just did.
And ladies and gentlemen, we welcome you to Harlem on HCR 90 FM Voice of
Harlem.
Tonight, ladies, veteran of with us tonight, Dr. Brady Pierre Louis. He is a cardiologist, actually assistant professor in the cardiology division at Harlem Hospital Center. Recently published an EKG book, correct?
That's correct.
Yes.
Respected and professional.
True story. And he was out there with us at Harlem Day, actually the last couple of years, letting people know about the dangers of heart disease. But tonight, ladies and gentlemen, we will be talking about the cardiac exam and why you need to know your grade. Very important topic. And Dr. Pierre Louis, welcome back to the show. It's been a while.
Yeah, no, it's always a pleasure to be here. Always a meaningful learning experience for me and a wonderful opportunity to educate our community about some very significant concerns related to heart disease that we've elaborated on previous shows. So
yeah, because you was here. You was here in August.
Yeah, exactly.
But I believe that this conversation is something that we always need to talk about.
True story.
Especially in this community.
The leading killer of Americans in the country. So we better be on this topic. If you ask me, we need to be on this topic every couple of months. And I think we make a very good point of even, with all of the things we talk about from week to week on the show, we always got something in there that's related to cardiovascular health, heart disease. We talk about the risk factors from week to week, the diabetes, the smoking, hypertension. That stuff always comes up. But tonight is a little bit of a different show, and we got the expert in the house, ladies and gentlemen. So get your pens and papers out and take some notes, because this is some important stuff. So Dr. Pierre Louis, just tell us about, from a cardiologist perspective, right? Because we have a bunch of different doctors that people see, primary care physicians, other specialists. But what is your take on the cardiac exam, and why do people need to start, I guess, paying attention to this no matter where they are in their lives right now.
No, that's an excellent segue. And, what we invariably discuss on this show as sort of the context for all of our discussions is the continuing reality that our communities face a disproportionate rate of morbidity and mortality, meaning death and sickness from heart disease. There have been a lot of innovations in cardiology in terms of medications and diagnostic evaluations, therapeutic interventions. But despite that, African Americans, Latinos, and very importantly, women of all ethnicities and races still continue to experience a disproportionate amount of disease related to the heart. And what we've done on previous shows is really talk about prevention. What are the things that everybody needs to know in terms of a heart-healthy diet, in terms of regular exercise, in terms of screening tests that should be done by your primary care physician to prevent heart disease.
Got it.
And what we were hoping to do with this show is educate the audience about the evaluations and examinations that we do to study the heart. The literature and research has been very clear that one of the reasons for the disparities that those respective communities face is that we are less likely to be tested. And we could speculate and elaborate on the different reasons why. We know that racism, sexism certainly is a reality in medicine, as it is in all segments of society. So there are concerns that doctors are at times less willing to refer our communities for tests. And that decreased testing results in increased disease. And that's been a mantra we've known for some time. And so our hope tonight is to really talk to people about what are some of the things we do to evaluate your heart. What are the signs and symptoms that require evaluation so that they can have intelligent and informed conversations with their providers about the different examinations that they may need.
So a quick question I have for you is, and you made a very good point as far as getting the exam. I know that when I get my annual exam, the heart, checking the heart or getting, what's the test called, the main test when you're getting your heart checked? It's
it depends.
EKG or something like that. And my thing
certainly.
is that the only time I've ever gotten an EKG is because I had like a chest pain and I went to get an EKG, but that's not something that is normally done as far as an annual physical. Do you think that there's something that should be mandated just from that comment that you just made or something like that?
Not necessarily to be, based on the literature. It is recommended that specific exams only be done if the patient presents with signs and symptoms of heart disease.
Gotcha. Okay.
The concern is, even when members of certain communities present with signs and symptoms of heart disease, they often will still not receive the appropriate tests. And so, again, our hope is to educate our listening audience that if you have signs and symptoms of heart disease, these are the exams that you should be offered, so that if you're not offered those exams, you can ask questions as to why.
Got it.
And that's really what we would like to have the conversation revolve around tonight. And the exams really start with, first and foremost, what we call the screening blood tests. So everybody, at least once a year, depending on what are called your risk factors, meaning pre-existing diseases you already may have, should have their cholesterol checked with a test called a fasting lipid panel. So that's a blood test that looks at your cholesterol level broken down into your good and bad cholesterol. Fasting meaning you should have that test without eating any breakfast. Usually you have it in the morning. And what that test allows us to do is see if you have any risk related to elevated cholesterol levels, which are definitely one of the risk factors for heart disease. The other screening blood tests we want everybody to have at the appropriate time, again, depending on their age and risk factors, is called a hemoglobin A1C. This is a relatively new test that evaluates for the presence of diabetes.
Yes.
So this is a test your doctor should offer you as part of your annual evaluation, ideally, again, at least once a year, particularly for African Americans over the age of 40. This test is recommended as an annual assessment. Everybody should have their blood pressure checked at least once, maybe even twice a year, looking for signs of hypertension. And the concern with these three risk factors in particular, high cholesterol, diabetes, and hypertension, is that they can ravish your body without significant symptoms, the so-called silent killers.
Gotcha.
So if you don't get tested and you don't get evaluated on a regular basis, you may have one of these diseases and not know it until it's too late. And I've experienced this in the hospital on, unfortunately, too many occasions. The first time a patient is diagnosed with diabetes, diagnosed with high cholesterol, and or hypertension is when they present with a heart attack or stroke, meaning it's too late.
Yeah.
Had we known you had these risk factors before, had we aggressively treated these risk factors with the appropriate medication and lifestyle therapy, research has been pretty consistent that about 80% of cardiovascular disease, specifically heart attack, strokes, and premature death, are preventable. So,
Can you repeat that?
Yeah,
Key
absolutely.
words.
Yes.
That was key.
That 80% of cardiovascular disease, specifically heart attacks, strokes, and premature death, are preventable with appropriate screening, identification of risk factors early, and lifestyle modification and aggressive medical therapy.
80%. That's a lot.
80%.
That is a huge
80%.
number.
Yes.
Preventable.
Yes.
Can you explain something? And it might just probably take you a couple of seconds because you're the expert right here. I know that the listening audience, they probably, as far as cholesterol, I know they probably always heard about bad cholesterol is LDLs and good cholesterol is HDLs. Can you explain that a little bit?
That was actually a very good and succinct explanation.
Okay.
We have two types of cholesterols in our bodies. One that promotes disease by clogging the arteries and eventually forming blockages, and one that essentially removes cholesterol from the bloodstream and stores it in a way that does not result in blockages of the arteries. So bad cholesterol, LDL, is the one that blocks the arteries and can lead to heart attacks and strokes. And HDL, the good cholesterol, is the one that removes cholesterol from the bloodstream. And an elevated HDL has been consistently demonstrated to reduce the risk of heart disease and stroke. So that's a very important difference. And a low good cholesterol is just as concerning and dangerous as a high bad cholesterol. So that's why it's important to have the complete lipid panel so that you know all of your risk factors, because there are things you can do to adjust both of those with lifestyle modification.
So I'm going to assume that as far as when you say bad cholesterols, that's like butter and the shortening and the lard, and the good cholesterols is like olive oil and fish oil and items of that nature.
That is exactly correct.
Got it.
Exactly correct.
And, just some things to be aware of, ladies and gentlemen, and I think we've made this point numerous times in the past on this show, is that there's no substitute for an official physical exam with your primary care physician. Because we have individuals, and this is great that I'm glad we have people participating in health fairs, going to different functions in the community. They get screening exams done there. But yeah, you might have your blood pressure, in the normal range at that event, or you might have it, your cholesterol might be low, but that's not the complete exam, and that's not, you require this regular testing so that we can do something about it. And I'm proud of modern medicine. We can do a lot for people nowadays, even people in advanced stages of disease. However, We're talking about, one, mortality, right? 80% of these deaths being preventable if we get a hold of this stuff very early. And another thing, we're talking about significant reduction in morbidity and disability from cardiac disease. We can keep you going for some years with cardiac disease, but it's not comfortable. It's not the best life for you. So that's what we're talking about tonight, ladies and gentlemen. We're going to take our first break for the evening. You're listening to Health in Harlem on WHCR 90.3 FM New York. We will be right back after this break, but you can call us at 212-650-6903 if you have any questions, comments, or concerns about tonight's show. That's 212-650-6903. We will be right back. Stay with us.
WHCR 90.3 FM New York.
This is the sound of salmonella gyrating on your undercooked chicken. And it looks like Mom might be taking it out a little early. Don't let salmonella get funky with your chicken. On average, 1 in 6 Americans will get a foodborne illness this year. So use a thermometer to cook each type of meat to the right temperature. Keep your family safe at foodsafety.gov. Brought to you by the USDA, HHS, and the Ad Council.
Together now, we can make it better now. Come on, can we do it? Yeah, you know that we can. We'll rope it up, cause we know how to jump. We'll roll it out, cause we know how to skate. We'll cut it down, cause we know what to eat. We'll swap it out, we eat healthy stuff.
Just moving a little and eating better every day can help make you and your kids healthier. Search We Can online to find doable tips and activities that you can use every day. That's We Can, a message from the Ad Council, HHS, and NIH's We Can program.
If you know the symptoms and get the facts, you'll know the signs of a heart attack. Women, listen to me, and when I'm done, if it sounds familiar, call 911.
Pain in your neck, chest,
arms or jaw,
shortness of breath,
please tell us more. Cold sweats and nausea, tiredness,
it's time to take it
serious. Back pain, stomach pain, shortness of breath, cold sweats, nausea, dizziness. If you know the symptoms and heed the signs, you'll be around for a long, long time. Women, listen to me, and when I'm done, if any sound familiar, call 911.
Learn a song that could save your life. Get a free download at womenshealth.gov/heart attack.
Women, listen to me, and when I'm done, if any sound familiar, call 911. If any sound familiar, call 911.
A message from the U.S. Department of Health and Human Services.
911.
WHCR 90.3 FM New York.
Welcome back to the one and only Health in Harlem on WHCR 90.3 FM New York. My name is Dr. Maurice Selby.
And this is Sean Shivers.
And tonight, ladies and gentlemen, we have with us from Harlem Hospital, Dr. Brady Pierre-Louis. He is an assistant professor in the cardiology division at Harlem Hospital Center. And tonight we are talking about the cardiac exam and knowing your grade. Ladies and gentlemen, very important conversation pertaining to heart disease. So we definitely need you to pay particular attention to everything that we talk about tonight. But before we get back to our conversation, I just want to make another announcement about the Muriel Pettione Women's Chiefs Council of Harlem Hospital Center invites you to celebrate Go Red for Women Day. This is actually taking place tomorrow, February 6, 2015, in the Martin Luther King Pavilion, the lobby of the Martin Luther King Pavilion at Harlem Hospital Center. The event will take place from 9 a.m. to 5 p.m. all day, but definitely worth the time. At this event, there will be free blood pressure screenings, which we mentioned in the beginning of the show, right? Part of the cardiac exam, the screening exam for everyone. But free blood pressure screenings, bone density screenings, informational handouts, on-site nutrition advice. There's a DVD on women and heart health, free giveaways, raffles, and much, much more. This event, once again, is sponsored by the Muriel Pettione Women Chiefs Council of Harlem Hospital Center, the Walk It Out program, the Departments of Cardiology and Pharmacy, and the Community Health Education and Outreach Department at Harlem Hospital Center. Okay, so definitely check this out. Once again, Go Red for Women Day tomorrow, February 6, 2015, in the Martin Luther King Pavilion of Harlem Hospital Center, right in the lobby there. It'll take place from 9 a.m. to 5 p.m. The Harlem Hospital Center is located at 135th Street and Lenox Avenue. You can take the 2 train or the 3 train, and it drops you right in front of the hospital. So definitely
you got
check
the personal
that
contact
out.
on the very bottom.
Oh, yes. And for more information, you can contact Dr. Lisa Ross. Dr. Lisa Ross.
Yes.
At 212-939-3550. That is Dr. Lisa Ross. You can contact her for more information at 212-939-3550 about tomorrow's event.
And also,
Go Red for Women Day.
Dr. Ross also wanted you to let everybody know what the raffle prizes are going to be for tomorrow.
Oh, yes, that's right. I did mention there will be raffles, ladies and gentlemen. So definitely check this out because you have the chance to win a 40-inch Samsung Smart TV. Too bad the Super Bowl was last week because somebody could use that, I'm quite sure. But 40-inch Samsung Smart TV. You got to throw the smart in there. Beats headphones. There's a Samsung tablet. There's a gift certificate to the Cecil restaurant. Been there. Very good. And also a gift certificate to Londell Supper Club. And so definitely check this out, ladies and gentlemen.
Starting to get hungry.
Yeah, right? Yeah. Oh, man. So, yes, Go Red for Women Day tomorrow. All right. So back to our conversation, ladies and gentlemen. At the beginning of the show, we talked about the screening exam. How during your annual physical exam, and this is something that everyone should be going to get. We established that. But at your annual visit, there are mainly 3 things that we need to have done at every visit. And we need your cholesterol. We need the full cholesterol or lipid panel, as it's called, with your LDL cholesterol, your HDL cholesterol, and also I think your triglycerides are included on there as well. Very important because just one label of cholesterol high or low is not enough. Correct, Dr. Pierre-Louis?
That is very correct.
And we also need the hemoglobin A1C to be measured, and your blood pressure has to be measured or should be measured at each of these visits every single year. Because those are the silent killers when it comes to heart disease. Now, you also mentioned that there are signs and symptoms, and now I'm curious as to when this changes from year to year, depending on a person's signs and symptoms, maybe risk factors that may develop if they become a smoker, or other exposures, or they find out some family history. A person, somebody's diagnosed with diabetes in their family. How does that change from year to year? And what are some of the signs and symptoms that we should be on the lookout for?
No, absolutely. So,
sorry about that.
That's all right. So as we stated, there's really no substitute for prevention. Our first and absolute goal is to prevent the onset of heart disease, including, and we really mean cardiovascular disease, including heart attacks and strokes. The unfortunate reality is that nearly 1 million Americans will experience signs and symptoms of heart disease, and specifically heart attacks, in the United States. And 25% of those will unfortunately experience a premature death as a result of that event.
So of those that experience some symptoms related to heart disease, a quarter of those individuals will have premature death.
Right. Right. And so we want everybody to be aware of the signs and symptoms of heart disease and the evaluations that you should have to ensure that your doctor has all the information they need to implement a strategy to keep you healthy. Okay. The number one sign that we educate everyone about, that people generally are aware of, is left-sided chest pain. The heart itself does not have pain receptors, very interestingly, but it releases chemicals that activate nerves in the heart that then are translated by the body as a sensation of pain. The heart is on the left side, so the pain is generally also on the left side. So the classic historic symptom of a heart attack is left-sided chest pain for all the Sanford and Son fans.
Oh, yes,
I
remember that.
Elizabeth, right? Showing my age a little bit.
I watched it. I love that show.
You know,
same here.
Interestingly, what we've learned over the last decade or two is that there are populations, diabetics, women, elderly patients, and some people argue even African Americans don't always have typical symptoms when they're presenting with a heart attack. So we really want to expand our repertoire and understanding of the symptoms you should be concerned about. So a succinct list: shortness of breath, right? New shortness of breath, decreased exercise capacity. You used to be able to walk 10 blocks. Now all of a sudden when you walk 10 blocks, you feel yourself having to stop and catch your breath. That didn't happen before. It's happening now. We call that decreased exercise tolerance. Nausea, vomiting can be signs of a heart attack. Palpitations, the feeling that your heart is racing even though you're at rest and not doing anything, can be a concerning symptom. Excessive sweating, again, while you're at rest and not exerting yourself, called diaphoresis, can be a concerning sign. And even non-specific symptoms like lightheadedness and dizziness and fatigue that we don't necessarily attribute to the heart can also be presentations of a heart attack. So we really want to say that any new symptom that you haven't had before, we have no issue with you coming to the emergency room and being evaluated for it. And Maurice, what we should say is an emergency room physician, and he'll be more than happy
True story.
to take care of you. So whenever you experience a new symptom, it's new to you, you haven't had it before, it's not gas, right? That's what we hear so many times from loved ones of people who come in late in their presentation. He had chest pain for 5, 6, 7, 8 hours a day, 2 days. But why didn't he come to the hospital? He thought it was gas. Did he ever have gas before? Never had gas before. If he did have gas, it was never this bad. So there's a change and something is new. Come to the hospital. Let the doctors tell you that it's not a heart attack.
Yes.
You know, that's really the important thing we emphasize. And then for stroke, people are generally familiar. It's a loss of function, right? When your brain starts to die, which is what a stroke is, the brain controls everything you do in your body. So you generally lose a function. Inability to lift or raise your arm. Inability to lift or use your leg. Inability to speak normally. Blurry vision. Loss of sensation or numbness in a part of your body. These are all signs of a potential stroke. And again, if you have any of these signs or symptoms, it's imperative that you immediately seek medical attention.
Yes, indeed.
Quick question, and I'm thinking, I've heard, and I don't know if I'm jumping the gun, is that whenever someone shows a sign of a heart attack and they come to the emergency room, that they're given an aspirin. Is there a reason behind that?
Yeah, a heart attack is invariably caused by a blockage in the artery that supplies blood to the heart muscle. That blockage is invariably a combination of the cholesterol we talked about, but also a blood clot, as the body tries to heal and repair itself, unfortunately leading to further damage. And what aspirin very simply does, it's
like
a
a blood thinner?
Exactly.
Oh,
So it will prevent the blood clot from propagating and further occluding the artery. When you have any of these signs or symptoms, which sometimes are severe, sometimes are mild, sometimes are moderate, there are specific things that your doctor should do to evaluate whether or not your heart is the cause of these symptoms. And these are the tests that we, want to educate the audience about. And very quickly, and then we can elaborate as you guys, at you guys' discretion. First and foremost is an EKG. An EKG is a non-invasive examination that we do to look at both the rhythm of the heart, but to also assess if there's any new or old damage that has been done to the heart muscle. It's a very simple, it's a very easy, and a very quick test, which can provide invaluable information about the status and condition of your heart, from an abnormal rhythm that could be causing your symptom, to a blockage in your artery that could be causing the symptom, to the enlargement of a chamber of your heart that could be enlarged, could be causing your symptoms. So in less than 5 minutes, and this is what Maurice was shouting me out about, the EKG book, right, we can gain invaluable insight into the state of your heart.
Yes.
If there are any abnormalities or concerns with the EKG, another test that we have available in cardiology is called an echocardiogram. As the name implies, it's still a non-invasive evaluation and test that uses sound waves, very similar to the ultrasound that you have when we have, but when women have when they have babies. But instead of looking at a fetus, it looks at your heart. The technology for echoes, as we call them, in short, has come a long way.
Yes,
we can look
indeed.
at your heart muscle. We can look at your heart valves. We can look at the great arteries that both supply blood and deliver blood to your body. And an echocardiogram, again, in 15 to 20 minutes, without poking or prodding you, can provide us with invaluable information about potential concerns that may be amendable to medical or other types of therapy.
Is it true that if you use an echocardiogram, that you can actually see if there is the clog, like clogging your arteries, or if there is, I guess it's the high cholesterol. Yeah, the clogging of the arteries. You can use the echocardiogram to see if there is a blockage?
The echocardiogram itself does not look directly at the blood vessels. However, there are findings on the echocardiogram which would absolutely raise concerns about the possibility of there being blockages in the arteries that supply blood to your heart. And along that same venue, another test that we do in cardiology, very importantly, is something called a stress test. A stress test is where using either exercise on a treadmill or medication, both of which are designed to increase the heart rate and elevate the blood pressure, we can determine non-invasively if there are any concerning blockages in the arteries that supply blood to the heart.
Yes.
Stress tests have been validated over about at least 2 decades now, that an abnormal stress test is associated with increased morbidity and mortality, meaning death and sickness, and a normal stress test is associated with the absence of morbidity and mortality. So if a patient presents to me with signs and symptoms of possible blockages in their arteries, shortness of breath, decreased exercise tolerance, chest pain, maybe they haven't gone to the ER because the symptoms weren't severe, but they came to my office and they're now describing these symptoms, this is a person that I would refer for an EKG.
Yes.
After the EKG, a regular echo, and after the regular echo, to rule out any overwhelming concerns, I would then refer them for a stress test. So if you have signs and symptoms of possible blockages in the arteries that supply blood to your heart, the symptoms that we discussed earlier, your doctor should ideally do these examinations. If you present to your doctor with these signs and symptoms and they don't mention or refer you for these tests, you have a right to ask why. Yes. Why are these tests not being done?
Be your own
Why
advocate.
are these tests not being considered? I learned that patients with signs and symptoms of heart disease should have these evaluations done for further assessment and to collect all the information that's needed to keep their hearts healthy.
Gotcha. I don't want to go to commercial. I want to learn more. I want to learn more.
We have to take a break.
Got you.
You got to let our listening audience digest this information because it's a lot, but it's very good information.
Very good.
And now, ladies and gentlemen, you are armed, okay, to be your own healthcare advocate. But we're going to take a very quick break. You're listening to Health in Harlem on WHCR 90.3 FM New York, the voice of Harlem. Stay with us. You can call us at 212-650-6903. That's 212-650-6903. We will be right back. Stay with us.
WHCR 90.3 FM, New York.
In celebration of Black History Month, WHCR salutes filmmaker William Miles. William Miles was born and raised in Harlem and is known for the films he made that showcase Harlem's illustrious history. Born August 19, 1931, his first-hand knowledge of Harlem gave his films credibility. For 25 years, he renewed archival films for Killiam Shows, Incorporated, and the Walter Reed Foundation in New York City. This led to his interest in documentary filmmaking. In 1977, his breakthrough film Men of Bronze debuted at the New York Film Festival and was later broadcast on PBS. It told the story of the 369th Infantry Regiment, known as the Harlem Hellfighters. The film put a spotlight on segregation in the U.S. Army and showed how valiantly black soldiers fought under the French flag in World War I. The Harlem Hellfighters spent more time in the frontline trenches than any other American unit. Other Allied troops included the French, Moroccan, and Senegalese soldiers. But his best-known work is a 4-part series he produced and directed in 1981 called I Remember Harlem. The film was a critical look at Harlem's famous and diverse history. Covering the 17th century through the early 1980s, the film covers the Harlem Renaissance, the Great Depression, the Civil Rights Movement, political activism in the era of Malcolm X, and the problems and redevelopment in the 1970s. He even showcased the community service Father Divine provided to Harlem residents during the 1930s by providing free and cheap meals to the poor. Miles received Oscar nominations, Emmy Awards for films like The Black West, and a Lifetime Achievement Award from the Association for Independent Video and Filmmakers. Miles's film archive is kept at the Washington University Film and Media Archive in St. Louis, Missouri. Mr. Miles currently lives in Queens, New York with his wife. William Miles, a true Harlem legend. To learn more about William Miles, visit www.historymakers.com.
WHCR 90.3 FM, New York.
Pride, but pain is a sickness that is hard to cover, and it's the reason we mistreat each other.
Welcome back, ladies and gentlemen. I'm Dr. Maurice Selby.
And this is Sean Shivers.
And you're listening to Health in Harlem on WHCR 90.3 FM New York, the voice of Harlem. And tonight we have with us Dr. Brady Pierre-Louis. He is an assistant professor of cardiology in a division of cardiology at Harlem Hospital. And tonight we're talking about the cardiac exam and knowing your grade. And we talked about a lot of the concerning signs and symptoms in the last segment. Left-sided chest pain, shortness of breath, decreased exercise tolerance. You just can't walk as far as you used to without getting short of breath. Palpitations, excessive sweating, especially if you're just at rest. These are some of the things to look out for. And we also talked about some of the testing, which we'll even go back into and elaborate on in this segment. But we do have a caller on the line. Caller, are you there?
Yes, I am.
How you doing, Brother Smiley?
Yes, I want to say good evening to all of you. And I would like to ask Dr. Louis, is there any possibility of keeping things under control by self-monitoring with a blood pressure machine periodically? Is there a balance that can be achieved? Or just say, can we make kind of important notations if the blood pressure changes?
No, that's an excellent question. And ambulatory blood pressure monitoring, which is what you're describing, having a blood pressure machine at home and monitoring your blood pressure, usually at specific times of the day, early in the morning, sometime in the afternoon, and then before you go to sleep, is actually something we recommend for all of our patients who are being treated for hypertension. We know that there are significant variations in blood pressure throughout the day, depending on the particular patient, and knowing when those variations occur can help us to tailor the medical therapy and individualize the care for each patient. Once you have been diagnosed with high blood pressure, we generally are pretty adamant that you do require medical therapy to keep it under control. We certainly have patients who want to try lifestyle modification, self-monitoring, and holistic techniques, garlic pills being one of the favorite that I hear about. And, I'm obligated to be honest about what I know, which is based on research and clinical trials that have been done. And the medical therapies that we provide for blood pressure have been shown to reduce morbidity and mortality in a way that holistic remedies, for instance, have not. So absolutely, home monitoring of blood pressure is strongly advocated for patients with hypertension, but it is not a substitute for medical therapy that's prescribed by your doctor.
Thank you. Should you eat before you take the pressure, or is there a scenario that you should follow and taking on this monitoring?
Yeah, generally based on the times that we recommend, there should be some time after eating before you take your pressure. That's why we usually say first thing in the morning, certainly before you've had breakfast, literally as soon as you wake up, take your blood pressure. Before you go to sleep, so again, the idea being that you haven't eaten right before you're ready to go to bed. And then sometime in the afternoon would probably be 2 to 3 hours after lunch and before dinner. So yes, that's a good point. There should be some time between having a meal and taking your blood pressure.
Thank you for this free advice.
Thank you for calling.
Thank you very much for your questions. Always, Brother Smiley. And we just asked, thank you for tuning in.
Yes, sir.
All right.
Have a good night. Thank you.
Okay. So, yeah, man, this is, I'm
a very good teacher. No offense. I just want to let you know that you are an excellent speaker and a very good teacher.
Story.
For something that's very, it's difficult, especially for non-clinicians like myself.
Yes.
Very simple.
But I'd like to point out, and I think Brother Smiley for actually pointing this out, is that, there's you can't just leave this up to your providers, right? This is an exchange. This is a relationship between you and your primary care physician. If you have a cardiologist, it's a relationship between you and your cardiologist. And, as much as we want to do for you and as much as we can do for you, there's a lot on your plate in terms of your responsibility, right? And we talked about some of the risk factors earlier, right? And some of these things are actually risk factors that we can control, such as the smoking, right? Limiting your intake of alcohol, because that could do horrible things to your blood pressure and other damage throughout the body. But just taking into account, looking at these things, monitoring your blood pressure at home, being very aware of how you're feeling. If you couldn't do those extra reps at, the weight that you did before and you getting short of breath, don't just say, oh, man, I'm going to just work harder. This might be something concerning. You need to bring it up at your next primary care doctor visit, just so that and you're on the same page and we can get you that appropriate testing, the EKG, right, or the echocardiogram, the stress test, so that we can make sure that everything is fine. And in an ideal world, right, people might be saying, well, you just want to test us and make money off of us and all that stuff. In the ideal world, myself and Dr. Pierre Louis would like to be out of jobs, to tell you the truth. That's why we're in the profession, is to do the right thing for people, keep people healthy. And that's the key, man. But, and
also at Harlem Hospital, I can definitely say that when you go in, you're not a number. You know what I'm saying? You're not a number. You are a human walking in to the building, getting the medical assistance that you need.
True story. And remember, the key point in all of this is that 80%, Dr. Pierre Louis said, 80% of early or premature deaths that are attributed to cardiac disease are preventable. 80%. That's an extraordinary number. And this is why we need to get a hold of this stuff early. Now, in terms of additional testing, we mentioned the EKG, we mentioned the echocardiogram, the stress test, but there's another very important test that we can do to actually look at the vessels, correct?
Exactly. So those 3 tests are what we classify as non-invasive. They involve no poking, no prodding, no needle sticks. They essentially look at your heart from outside of your body. Obviously, the echo is penetrating your skin and bones and taking a direct image of your heart, but it's still looking from the outside. Mm-hmm. These are generally tests that we do in patients that we have what we call intermediate levels of concern. We're moderately concerned. When we have a patient that we are very concerned about, who has a high level of concern, we now want to do a test that looks inside the heart itself. This test is called a cardiac catheterization. Mm-hmm. It involves placing needles and eventually wires in the arteries that supply blood to your arms or legs, then using those needles to thread a wire that travels and follows the flow of blood to the arteries that supply blood to your heart, and then using X-ray technology and contrast dye, looking inside the arteries themselves to definitively determine if there are any blockages that need to be managed. So the EKG is non-invasive. It gives us important insight. The echocardiogram is important. It gives us invaluable insight. If we're concerned, the stress test gives us the probability of there being a blockage. And when we have a very high level of suspicion in a patient presenting with signs and symptoms of heart disease, as we discuss, we now need and want to look inside the arteries themselves, mm-hmm. and we'll refer the patients for a cardiac catheterization. The literature has been very clear. African Americans, Latinos, and women are less likely to be referred for cardiac catheterizations than other patient populations. And there is a concern, particularly when indicated, that the lack of referral and the lack of testing results in increased morbidity and mortality.
Wow. And
you raised a very interesting point earlier in terms of patients being their own advocates. Doctors are human, right? We have, hundreds of patients that we see. We're under pressure. We're under stress. Mm-hmm. When a patient sits across from us and demonstrates insight into their disease, my level of alertness increases. That's just a human reality. When a patient demonstrates that they know what tests they should potentially have, know what the medications they're on are for, express insight into the things they're doing to make themselves healthier, my level of alertness goes up. And so by advocating and being educated, and that's a good thing. And that's also human nature and reality, right? The squeaky wheel, so-called. So educated patients live longer and live better. And that's not a coincidence, right? When you are your primary advocate and you use me as a tool to promote your health, you do better. And I think that's really what we want to impart on the listeners today.
True story.
Is have the information, have the knowledge, and have a discussion with your doctor. Not a lecture from your doctor, not a tirade from your doctor, but a meaningful back and forth discussion about your health using the doctor's insights coupled with your own research and knowledge to decide what's best for you as the patient. And I have patients challenge me all the time, about my recommendations. And honestly, those are some of the most stimulating conversations that I have in my workday.
Good.
That's what we want to do. Know what these tests are for, know what these tests are about, know when you should have these tests, and ask your doctor when are these tests indicated for you.
Gotcha.
We're going to take a very, very quick break, ladies and gentlemen. You're listening to Health in Harlem on WHCR 90.3 FM. We'll be back in a minute. Stay with us.
WHCR 90.3 FM, New York.
Hi, I'm Vinny B of the Vinny B Showcase. Tune in every Thursday from 8 to 12 midnight for some solid cultural roots music and some sweet lovers rock. Also, informative interviews and giveaways. Right here on the Vinny B Showcase every Thursday, 8 through 12 midnight on WHCR 90.3 FM. Peace.
WHCR 90.3 FM, New York.
Welcome back to Health in Harlem, ladies and gentlemen. My name is Dr. Maurice Selby.
And this is Sean Shivers.
And tonight, ladies and gentlemen, we have Dr. Brady Pierre-Louis. He is an assistant professor in the cardiology division at Harlem Hospital Center. And we're talking about the cardiac exam and knowing your grade. And very, very important before the break, man. I think it's really very well said. And the way I like to look at it is that, yes, you have to be your own healthcare advocate. And, you know, just as Obama has his cabinet, right? He's not a scientist. He doesn't know about atomic energy. He doesn't know about fuel, right? Fossil fuels and global warming and all this. He has experts that are in his ear giving him information, and then he takes that information and makes a decision based on that. And this is exactly how you should use your physician. You tell them what's going on, your signs and symptoms, your concerns, ask questions, and they're going to give you their opinion as an expert, as a professional. And then you come together and you come to a decision based on the information that they give you, and be honest, and choose somebody that you can have these discussions with and that you feel comfortable with, so that you can make the decisions that are best for you, because the power is in your hands. But you just have to use it. I like how you said as a tool, use this as a tool to accomplish your goals in healthcare.
Exactly.
Yeah.
For real. So as we begin to wrap up, Dr. Pierre-Louis, what are some of the things that people must take away from tonight's show?
I just wanted to quickly answer something that Sean asked me during the break in talking about the cardiac catheterization.
Yes, please.
It is an invasive procedure. And like all invasive procedures, there are some associated risk that the patient will be exposed to. But this is a technique that has been developed now for about 4 decades. And so the safety of the cardiac catheterization procedure in 2015 is extremely safe. The risk of a complication, be it bleeding or an infection, is extremely, extremely low. I believe it's 1 in every 10,000. So significantly less than 0.0001%. There are risks because we are introducing foreign objects into the body, so I certainly don't want to say that there are no risks. But in medicine, we do what are called risk-benefit analysis. And what I can very confidently say about the cardiac catheterization, again, in 2015, is that the benefits of diagnosing a blockage in an artery that supplies blood to your heart, which could lead to a heart attack and either leave you disabled or, worse, dead, the benefits of that significantly outweigh the risk of any potential injury from the procedure. So if your doctor recommends this test, as with all recommendations, you should research and ultimately determine for yourself if this is the best choice for you, but be confident and be secure that it is a very, very safe procedure.
So would it be safe to say that if you eat right, drink water, exercise, lose the weight,
get
don't
your
drink,
regular
don't
exam.
smoke, sleep, get your regular exam, nine times out of 10, you won't have that many patients?
Well, I think Maurice made a very interesting point that I think not all doctors are going to be too excited to hear, but it's very insightful. The idea is to put us out of business.
Gotcha.
We deal with patients, particularly cardiologists, myself. By the time you see me, there's a problem. There's a concern. There's something wrong with your heart that you need diagnostic evaluations, therapeutic interventions, meaning medications, tests, and close follow-up on a regular basis. And your goal as a patient and as an individual is to never see me. I'm a nice guy. When you see me on the street and at cocktail parties,
I second that.
but you don't want to meet me in the hospital. And so everything you said is correct. And to Maurice's point, I think the big takeaway from tonight's discussion is be your own advocate first and foremost by doing the things that Sean just described perfectly to prevent heart disease. That's your number one goal. Do the things that we discussed to prevent heart disease, which include regular screening for diabetes, high cholesterol, and blood pressure. In the unfortunate event that you develop one of these conditions, follow your doctor's instructions in terms of both lifestyle modification and medical therapy to prevent the progression of these diseases to more concerning entities, specifically heart attacks and strokes.
Gotcha. And you can't say it no better than that.
Yeah.
True story.
Direct and to the point.
Yeah. And then the last point would be if you unfortunately develop signs and symptoms of heart disease, as we discussed, have an informative discussion with your doctor about the tests that you need to further assess and evaluate your heart, including the EKG, the echocardiogram, stress tests when indicated, and the cardiac catheterization. If you have signs and symptoms of heart disease and your doctor is not recommending or bringing any of these tests up, then you bring them up.
Or get a new doctor. No offense.
Or get a new doctor.
And so that's what we want people to take away from tonight's discussion.
Excellent.
All righty. Dr. Pierre-Louis, you are the man.
I learned so much.
Indeed.
And I thought I knew all of this from the last discussion.
Right.
I learned more.
Right.
True story.
Yeah.
And I think we approached it in a very different light today.
Yeah,
and the biggest point being 80% of early cardiac deaths being preventable. I mean, it doesn't get any more clear than that you, as we said before, you need to be going to these exams every year. You need to be getting those basic screening tests, the cholesterol, the hemoglobin A1C, the blood pressure, and, just keep being your own healthcare advocate. Extremely important.
Exactly. You got to keep saying
important.
that. We got to definitely keep saying that.
Absolutely.
But thank you very much, Dr. Pierre-Louis.
Thank you very much.
Always welcome to join us again.
And I definitely look forward to coming back in the spring.
That sounds like a plan. Sounds like a plan.
Always. Yep.
And I want to thank my man, Sean Shivers.
Thank you, my brother. And February is Children's Dental Health Month. February, a good time to make sure your kids have regular checkups and are brushing 2 or 3 times a day. The American Dental Association recommends that children have their first visit to the dentist by the time they get their first tooth or by the time they are 1 year of age. Developing good habits at an early age and scheduling regular dental visits helps children get a good start on a lifetime and healthy teeth and gums. And our guest next week is going to be Dr. James King, the Director of Dentistry, and our conversation is basically going to be children's dental Health Month.
Two
Making
of my
sure
favorite
your
guests,
kids,
man. Dr.
making sure
Pierre
your
Louis
kids
and
have
Dr.
great
King.
teeth.
And listen to this to show you how the body is connected. It's been recently established that poor dental hygiene is a risk factor for heart disease.
I heard that.
Yes. That's right. Dr. King talked about it too before he mentioned
they
that.
are absolutely linked. Yes.
So let's put it all together
connects.
next week, man. We're gonna make sure that we have a very well informed listening audience. I want to thank Valerie Wright. Valerie Wright is the producer of this show. She has been excellent, and we could not have a show without her arranging for wonderful guests like Dr. Pierre Louis, Dr. King. All of these wonderful people coming on and sharing this information. So thank you very much, Miss Wright. We want to thank our caller, Mr. Brother Smiley.
Faithful fan.
Yes, indeed.
Calls every time I'm here.
That's what's up. And he always has very insightful, very good questions that lead us to new directions in our conversations. And also, ladies and gentlemen of the listening audience, we want to thank you as well. We cannot have a show without a gracious and wonderful listening audience as well. This show is dedicated to the memory of Miss Gloria Thomas. Harlem, take care of yourself.
WHCR 90.3 FM, New York.
Hi, I'm Vinny B of the Vinny B Showcase. Tune in every Thursday from 8 to 12 midnight for some solid cultural roots music and some sweet lovers rock. Also, informative interviews and giveaways. Right here on the Vinny B Showcase every Thursday, 8 through 12 midnight on WHCR 90.3 FM. Peace.
There's hundreds of fun and simple things you and your family can do to live a healthier lifestyle. Here's 20 of them. Walk to work, walk the dog, have the dog walk you, take a hike, take a bike, skate, dance, hop, jump, do the Humpty Hump, skip seconds, skip dessert, skip to my loo, don't skip breakfast, drink H2O, lower your sodium, raise the roof, shake your booty, stock up on vegetables, and don't forget to eat them. Search We Can online to find more ways you and your family can get healthy together. A message from the Ad Council, HHS, and NIH's We Can program.
Righteous, can't you see the sign of the time we're living in? Got to use it every day. It's what we need today. Whoa. We got to use it every day. It's what we need today. Wisdom and knowledge will guide you through. Don't you be the devil too. No, you can't guide a people without a vision. You shall surely go astray. use it, yeah. Every day. That's what we need today. Oh, wisdom. Whoa. All right now. Oh, wisdom. The Bible can teach you wisdom, whether you wise or you dumb. An elder can teach you wisdom, whether you're old or you're young. Oh, wisdom, oh, wisdom, oh, wisdom. Only a fool trust in his own eye and disregard correction. You got to be humble, free from anger, and your days shall be low. You gotta use every day. It's what we need today. You gotta use it, yeah. Every day. It's what we need today. Oh, wisdom. Whoa. All right now. Oh, wisdom. Hey.
Fellow citizens of Africa, I greet you in the name of the Universal Negro Improvement Association and African Communities League of the World. As you are aware, the world in which we live today is divided into separate race groups and distinct nationalities. Each race and each nationality is endeavoring to work out its own destiny to the exclusion of other races and other nationalities. We hear the cry of England for the Englishman, of France for the Frenchman, of Germany for the German, of Ireland for the Irish, of Palestine for the Jew, of Japan for the Japanese, of China for the Chinese. We of the Universal Negro Improvement Association are raising the cry of Africa for the Africans, those at home and those abroad. The great problem of the Negro for the last 500 years has been that of disunity. No one or no organization ever succeeded in uniting the Negro race.
Was done for 300 years, the bodies of men. You can shackle the hands of men, you can shackle the feet of men, you can imprison the bodies of men, but you cannot shackle or imprison the minds of men. Turn them down, turn them down. Words from Marcus Messiah Garvey. Words, sound and power, power. They do not know what we are capable of. They do not know what we are thinking. They're thinking in terms of dreadnoughts, battleships, aeroplanes, submarines. You know what we're thinking about? That is our own private business. Turn them down. Turn them down. Words from Marcus Messiah Garvey. Words, sound and power. Power. Black men of Carthage, black men of Ethiopia, Timbuktu, Alexandria gave the light of civilization to this world. Ethiopia shall stretch forth her hands unto God, and princes shall come out of Egypt. Because classes, nations, races have been quite for over 4 centuries. Who was merely born of use, insult, humiliation, whose forbearance can only be compared to the prophet Job, as likewise lifted his bowed head and raised it up to God's skies and cried out, I am a man, and demand a man's chance and a man's treatment in this world. I shall teach the black man. I shall teach the black man to see beauty in his own kind and stop bleaching his skin and otherwise looking like what he's not.
African freedom, African freedom, chant them down, chant them down.
God made man Lord of his creation, gave him possession and ownership of the world. And you have been so darned lazy that you've allowed the other fellow to run away with the whole world, and now he's bluffing you and telling you that the world belongs to him and that you have no part in it. I don't have to apologize to anybody for being black, because God Almighty knew exactly what he was doing when he made me black. If black people knew their glorious past, then they would be more inclined to respect themselves. Yes, you heard of Johnny Walker Red and black. Well, he had his adversities, but he's still going strong. Well, I intend with your help and God's grace to continue, because my work has only just begun. And future generations shall have in their hands the guide by which they shall know the sins of the 20th century. I know, and I know you too believe in time, but we shall wait patiently for 200 years if need be to face our enemies through our posterity. When my enemies are satisfied, in life I shall come back, or in death even to serve you as I served before. In life I shall be the same, in death I shall be a terror to the cold.
Teach them, Gavi, teach them. Tell them, Gavi, tell them. Want them, Gavi, want them. Chant them down. Chant them down. Gavi, Mosiah, Gavi.
If death has power, then count on me to be the real Marcus Garvey I would like to be. If I may come in an earthquake or a plague or a pestilence, or as God would have me, then be assured that I shall never desert you and make your enemies triumph over you. Will I not go to hell a million times for you? If I die in Atlanta, my work will only just then be